Your body often sends quiet warning signals long before serious disease shows up. Many people do not realize that your skin, nails, urine, and even your breath can reveal hidden problems with your kidneys if you know what to look for. Kidney disease is more common than most people think, and in many cases it develops silently. A huge number of people living with chronic kidney disease do not even know their kidneys are slowly losing function. This becomes dangerous because early kidney damage can often be treated or slowed down. But once the disease progresses too far, the damage may become permanent, which is why early warning signs are very important. In this video, you will discover warning signs that may suggest your kidneys are under stress. Some of these signs are subtle and easy to ignore, and many people mistake them for harmless, everyday problems. Your kidneys are two small bean-shaped organs located in your lower back, just beneath your ribs. Many people think their only job is to filter waste, but in reality, they perform many critical tasks that keep your body balanced. These organs help control fluid levels, regulate minerals like potassium and salt, maintain healthy blood chemistry, and support strong bones and blood production. When kidneys struggle, many body systems begin to suffer. So how can you tell if these hardworking organs are starting to fail? One early warning sign can appear in something most people overlook: your urine. If you ever notice thick foam in your urine that does not quickly disappear, it may be more than harmless bubbles. Persistent foam can mean protein is leaking into your urine, which is not normal. This happens when tiny filters inside the kidneys become damaged. Normally, these filters keep important proteins in the blood while allowing waste to pass into urine. When these filters weaken, proteins escape into the urine and create thick foam that stays on the surface. This can be one of the earliest visible warning signs of kidney trouble. There's also a simple check you can do right now that may reveal another hidden sign. Gently press your thumb into the front of your lower leg for about 5 seconds, then release and watch what happens. If an indentation remains for a few moments before disappearing, this may be a sign of fluid buildup known as swelling. This condition can occur when important proteins in your blood drop to low levels. These proteins normally help keep fluid inside your blood vessels. But when protein leaks into the urine, fluid escapes into surrounding tissues, leading to swelling in the legs, feet, or even around the eyes. You might think swelling simply means you're holding too much water, but the situation is more complicated. When fluid leaves the bloodstream, your kidneys may mistakenly think your body is dehydrated. As a result, they hold on to even more salt and water, making the swelling worse. In severe cases, fluid can build up in the lungs, causing shortness of breath and making everyday activities feel exhausting. However, it's important not to panic. Mild swelling can happen after standing or sitting for long periods. But if swelling doesn't improve overnight or keeps returning, it may be worth getting checked. Another common misunderstanding is believing that frequent urination always means healthy kidneys. In reality, the quality of your urine matters more than how often you go. One of the earliest problems with struggling kidneys is losing the ability to concentrate urine properly. This often becomes noticeable at night when your body should naturally produce less urine. If you find yourself waking up multiple times during the night to urinate, this condition, known as nighttime urination, could be an early warning sign that your kidneys are not functioning as they should. Now take a closer look at your fingernails. Most healthy nails have a natural pale area at the base that looks like a small half moon. This is completely normal and simply reflects healthy nail growth. However, in some people with kidney problems, the nails may develop an unusual two-tone appearance. Instead of a clear half moon, the nail may look divided into two distinct colors, often pale near the base and darker toward the tip. This pattern is sometimes called half-and-half nails. While not everyone with kidney disease develops this change, it has been strongly linked to long-term kidney problems and should not be ignored. Another hidden issue involves a mineral called phosphate. Your body needs phosphate in small amounts, and most of it comes from the foods you eat daily. Healthy kidneys remove excess phosphate from the blood without difficulty. But when kidney function declines, phosphate begins to build up, and that buildup can create serious complications throughout the body. When phosphate levels rise, it can bind with calcium to form hard crystals. These crystals may settle in the skin, appearing as firm, yellowish bumps that feel hard beneath the surface. Sometimes these bumps may break open and release a thick substance that looks like toothpaste. Although this can be alarming, it signals that mineral levels in the body are no longer balanced. Even more concerning is when these crystals collect inside blood vessels. When this happens, blood flow may become restricted, increasing the risk of severe tissue damage and other dangerous complications. Over time, excess phosphate can also cause blood vessels to lose their flexibility. Instead of being soft and stretchy, they may become stiff and hardened, similar to bone. When blood vessels stiffen, it places extra strain on the heart and reduces proper circulation, increasing the risk of serious cardiovascular problems alongside kidney disease. To fight rising phosphate levels, your body releases special hormones that try to push more phosphate out through urine. At the same time, these hormones reduce the amount of calcium your body absorbs, which can lead to new problems. When calcium levels drop, your muscles may start reacting in painful ways. Many people notice sudden muscle cramps, especially at night when the body is supposed to be resting. These cramps can feel sharp and intense, sometimes waking you from sleep without warning. If muscle cramps appear without a clear cause, like new exercise or dehydration, it may be worth checking your kidney health. Low calcium levels can also trigger another chain reaction inside your body. Your body releases hormones that pull calcium from your bones to keep blood levels stable. While this helps in the short term, it weakens your bones over time. Bones may become thin, fragile, and more likely to break, even from minor falls or simple daily movements. One warning sign of weakening bones is a gradual loss of height. Some people notice their posture changing or realize they are shorter than they were just a few years ago. Fractures of the wrist, spine, or hips after a minor fall can also signal underlying bone weakness linked to kidney problems. As kidney function declines further, waste products that should normally leave the body begin to build up in the bloodstream. This buildup of toxins affects many parts of the body. One of the earliest and most frustrating symptoms caused by these toxins is persistent itching. Unlike normal itching, this sensation can spread across the whole body and often becomes worse at night. Some people scratch their skin until it becomes sore or even starts bleeding, without realizing that the root cause may be related to their kidneys. This intense itching happens because waste products that should leave through urine begin collecting in the skin. These substances irritate nerve endings and make the skin feel constantly uncomfortable. Over time, the nerves responsible for sensing itch can become overly sensitive. In severe cases, the brain itself may stay stuck in an itch mode, making relief feel almost impossible. Another nighttime problem linked to kidney trouble is an uncontrollable urge to move your legs. This condition, often called restless legs, can make it very hard to relax or fall asleep. People with this condition often describe a crawling, tingling, or pulling sensation deep inside the legs. Moving the legs may give temporary relief, but the feeling usually returns once you stop. This uncomfortable sensation is believed to be linked to low iron levels in the brain. As kidney problems worsen, certain toxins interfere with how the body manages iron. These toxins can trigger inflammation, causing the body to lock iron away instead of using it. Without enough available iron, the brain struggles to produce important chemicals needed for smooth nerve function. As a result, sleep becomes disrupted, leaving many people feeling exhausted during the day. If sleep problems continue without a clear reason, kidney health may be worth investigating. Kidney problems can also change the way food tastes. Some people begin to notice a strange metallic flavor in their mouth, even when eating foods they once enjoyed. This happens because certain waste products mix with saliva and are broken down into chemicals that affect taste receptors, creating an unpleasant metallic sensation. Along with changes in taste, some people notice their breath developing an unusual smell. In advanced cases, the breath may carry an odor that resembles urine, which can be embarrassing and difficult to ignore. These taste and smell changes often reduce appetite. When food tastes unpleasant and nausea begins to appear, many people naturally start eating less than usual. Over time, this loss of appetite can lead to noticeable weight loss without trying. Clothes may feel looser, and energy levels may drop as the body receives fewer nutrients. The buildup of toxins in the bloodstream can also trigger nausea and vomiting. This happens because certain areas of the brain are highly sensitive to harmful substances. When these brain centers detect toxins, they send signals that cause nausea as a protective response. Unfortunately, in kidney disease, this reaction happens even when there is no food poisoning. Another warning sign to watch for is easy bruising. You might notice large bruises appearing on your skin even after very minor bumps or sometimes without remembering any injury at all. Under normal conditions, your body uses tiny blood cells called platelets to stop bleeding quickly. These platelets stick together to form clots that seal damaged blood vessels. But when kidney function declines, toxins interfere with how platelets work. This makes it harder for your blood to clot properly, increasing the risk of bruising and bleeding. Some people may also notice bleeding gums when brushing their teeth or frequent nosebleeds that seem unusual or harder to control. If these symptoms appear alongside other warning signs, they may indicate that your kidneys are no longer working as efficiently as they should. In advanced stages of kidney problems, some unusual skin changes may appear. In rare cases, a fine white powder may form on the skin after sweating, especially when waste products become extremely concentrated in the body. This powder-like substance forms when toxins leave the body through sweat and dry on the skin. While uncommon, this is considered a serious warning sign that kidney function has dropped to very low levels. Another late complication involves inflammation around the heart. The heart is surrounded by a thin protective layer, and when toxins build up, this lining can become irritated and inflamed. This inflammation can cause sharp chest discomfort that worsens with movement or deep breathing. In some cases, doctors may even hear unusual rubbing sounds when listening to the heart. While these severe signs usually appear later, many people experience symptoms much earlier that are easier to overlook. One of the most common complaints among people with kidney problems is constant fatigue. Fatigue can develop for many reasons when kidneys are not working properly. Poor sleep caused by itching, cramps, or restless legs can leave you feeling drained throughout the day. Changes in body chemistry and toxin buildup also contribute to low energy. However, there is another major reason people with kidney disease feel unusually tired. Healthy kidneys produce a hormone that signals your body to make red blood cells. These red blood cells carry oxygen to your muscles and organs, keeping you energized and active. When kidney function declines, production of this hormone drops. As a result, red blood cell levels decrease, leading to anemia, a condition that makes you feel weak and short of breath. Simple activities like climbing stairs, walking short distances, or carrying light objects may suddenly feel much more exhausting than before. In many cases, one of the most dangerous signs of kidney disease is having no symptoms at all. The condition can quietly progress for years without causing noticeable problems. Doctors usually divide kidney disease into stages, ranging from mild damage to severe failure. Unfortunately, many people don't notice symptoms until the disease has already reached more advanced stages. Sometimes the only way kidney disease is discovered early is through routine blood or urine tests. That's why regular health checkups can play a major role in protecting your kidneys. Prevention is extremely important because many of the causes of kidney damage are linked to everyday health conditions that can be managed or avoided. Two of the most common causes of kidney disease are diabetes and high blood pressure. Both conditions can slowly damage the tiny blood vessels inside the kidneys over time. When blood sugar or blood pressure remains uncontrolled for years, it places continuous stress on the kidneys, gradually reducing their ability to filter waste from the blood. Another growing concern is the overuse of certain pain medications. Many people take these drugs regularly without realizing that frequent use can strain the kidneys. Pain relievers that are easily available without a prescription may seem harmless, but long-term use can increase the risk of kidney injury, especially when taken in large amounts. These medications can also irritate the stomach and affect the heart, making it important to use them carefully and only when truly necessary. If you find yourself relying on pain medication often, it's wise to speak with a healthcare professional and consider checking your kidney function. Taking care of your kidneys doesn't always require complicated treatments. In many cases, small daily choices, like managing blood pressure, controlling blood sugar, staying hydrated, and avoiding unnecessary medications, can make a huge difference. Your kidneys are incredibly powerful organs, quietly working every second to remove waste, balance fluids, and keep your body functioning smoothly. Yet most people only think about them when something goes wrong. The truth is, your body often gives warning signs long before serious damage occurs. The challenge is knowing how to recognize those signs early and taking action before problems become severe. If you've noticed several of the symptoms discussed in this video, it doesn't automatically mean you have kidney disease. However, it does mean your body may be asking for attention. Getting simple blood and urine tests can provide valuable information about how well your kidneys are working. Early detection gives you the best chance to protect your kidney function and avoid long-term complications. The good news is that many kidney-related problems can be slowed or even prevented with the right habits and medical guidance. Small changes made today can protect your health for years to come. So take a moment to pay attention to your body. Notice the signals it sends, no matter how small they seem. Those quiet warnings could be your chance to act before it's too late. Your kidneys work tirelessly to support your health every single day. Giving them the care and attention they deserve is one of the smartest investments you can make for your future. Stay informed, stay proactive, and most importantly, stay committed to protecting your health. Because when your kidneys stay healthy, your entire body benefits. And if you found this information helpful, consider sharing it with someone who might need to hear it. Sometimes, a single piece of knowledge can make the difference between early prevention and serious illness.